the next speaker. Yes, we have been doing really fantastic since morning. We have gone from really complex cases. Today, we got to also understand much more about IV nutrition as well, and in fact, much more than that. Now we move on to a condition that affects the whole body, lupus. Probably people don't even talk about it. It's complex, unpredictable, and often so hard on the patients because nobody wants to even talk. But when we bring different healing systems together, which we have been talking about since yesterday, integrating everything, results can be truly life changing. I don't even need to say this because we have already been seeing so many cases where we are learning stuff. So, our next speaker, who is an MBBS MD in Dermat, Dr. Mankul Goyal, he's a person who loves to look at the whole person and again, not just the disease. What makes Dr. Mankul special is that he has an integrative approach. Again, trained in Ayurveda, homeopathy, acupuncture, nutrition, functional medicine, ozone therapy, energy medicine, and all of this together he brings in his particular clinic in Delhi. He has a name by the name of Sampurnam Holistic Clinic in Delhi. Now, he often says something important. The skin. The skin is a window to inner health. Today, he's going to show us what it exactly means by sharing a powerful case of a 40-year-old woman with lupus who had tried allopathic treatments and Ayurveda, got only partial relief. But when she followed the integrative plan, combining all the different systems, she not only recovered, but she has stayed symptom free and off the medication for 3 years now. Let's look at this story of true holistic healing with Dr. Mankul Goyal. Let me bring you on stage. Very good afternoon, sir. How are you doing?
Thank you, Amarjeet, for the wonderful and warm introduction. And thank you to the whole IFM team for bringing this together and bringing a cause forward which is greater than each one of us here. And the cause is to make medicine back again something where we understand that healing can be natural and healing is supposed to be natural. I mean, we are, as all doctors and healers and functional medicine practitioners and nutritionists, are facilitating healing. And we all remember that healing is happening on its own. We are just facilitating it in small ways.
Beautifully said, sir. The screen is all yours.
Thank you. Share my presentation.
The timer will be on the right top corner of the screen. You may put it on slideshow mode.
So before we start, because integration calls for a certain depth of consciousness, I invite all of you to take a little breather and take a 30-second centering practice where we all sit straight and take a few deep breaths and visualize a lotus at the center of our heart. Just take 3 deep breaths. And with each breath, we go deeper into that lotus in the heart. And we acknowledge every feeling that we are feeling in this moment, whether it is excitement of learning something new or feeling overwhelmed with so many different modalities that we are exposed to, or this new hope that is coming in with newer possibilities at the horizon. And we embrace them with gratitude, and we open our eyes for this next talk. So first I'm going to share about 2 cases, one in a little more detail and another one very briefly during this talk. And after that, I'll be talking about some key aspects of lupus, some key interesting functional aspects of lupus and how to address that. And then we'll talk about the art of integration. So I start by sharing this case of a 40-year-old female. Let's call her by the name Neha. That's not her true name. Who came to me with discoid lupus erythematosus. So that's a form of lupus which presents on skin as bald patches. And this is one form of bald patches where the areas on the scalp or body, they scar. So wherever you get those inflammatory loss of hair, the area gets scarred, so the hair can't come back. So the stakes become very high, especially because of the psychosocial impact it has on the person. There are other autoimmune conditions, as we all know, like alopecia areata, where there is always a possibility of hair coming back. But here the stakes get very high because they lose them forever. So that's what she was having, and she had already had it when she had come for 2 years. And as Amarjit shared, she had tried as a standalone allopathy at one of the hospitals, and then she had done Ayurveda, and all from leading doctors in the country. When she came, she was struggling because the patches were increasing. Along with that, she had been hypothyroid for more than 5 years, and she also had acidity, which she described as headaches. Yeah, patients say gas sir mein chad jati hai. And she had bloating and flatulence, those issues. She also had anxiety and fatigue or low energy, and a weight gain tendency. There was a significant family history of alopecia, but this time in the family it was alopecia universalis, which is a form of alopecia areata. But where in this form the person loses all their hair on their body or on the scalp and face, and that was her dadi grandmother. She also had breast and uterine cancer in the family. So when she was here on the first visit, and because she comes with she's not coming to a functional medicine doctor, she's coming because I'm an allopathic doctor, MBBS, MD. So she doesn't know anything about integrative medicine. She's come here to talk about how does she take care of the disease, no matter what's the means. Personally, in our practice, the starting point is first help the person survive before thrive. So we introduced the medicine hydroxychloroquine, which is one of the allopathic medications, which is not as immunosuppressive, but is more of a immunomodulator. How I explain that to the patients is suppression is more like, if your immune system is a child, you tie them up nicely and then, he can't speak. Modulation is more like, you have a conversation with the child and, you quietly make them understand. So hydroxychloroquine is more of a modulator than a suppressor. So that was the first thing, and it is about being contextual. We can all talk about just healing people naturally, but sometimes people do need a medication, and that was the starting point. And then we did her lab tests, and on the lab tests, we discovered that was October 21. We discovered that her insulins were high. Her PP insulin was 65, which is best around 30 to 40. Her thyroid antibodies were high, and of course, she was on a thyroid medicine. TSH was normal. TTG gliadin negative. Her DHES, it's not highlighted, but it was low, 77. We'll discuss about it, how it's a common pattern in lupus, that the DHES can be low. And the B's and homocysteine was slightly high. And her ANA, of course, was positive, 1:60 speckled pattern. We also did a food intolerance test for her, which was showing up gluten, egg, almond, yeast, beans, and peas intolerance. So these were the basic preliminary data we gathered back in 2021 for her. On the second visit, we had certain level of clarity on the diagnosis. That's discoid lupus erythematosus, autoimmune thyroiditis, hypothyroidism, insulin resistance with an ANA positive. Usually we go about explaining this to the patients in a phlegm fire model, where we are seeing both insulin resistance and autoimmunity at the same time. So basically, from a medical terminology, we refer to it as insulin resistance and inflammation. But for a patient's point of view, it's like phlegm and fire. Phlegm is like if you have wooden fuel, you have wood and oil or ghee, and then your inflammation is like a matchstick. So if you just have a matchstick, there is no fire. If you just have wooden fuel, there's no fire. When you have both together, then you have a big fire. And insulin resistance does that in the body. It builds up a toxic material. Again, taking a cue from alternative medicine, Ayurveda, and acupuncture, who describe ama or undigested food as the root cause of disease. And now, from functional perspective, we understand how that leads to SIBO, SIFO, and so many other conditions. And then those LPS and toxins, they spread all across the body and inflaming the tissues. So the ama spreads all across wherever there is a weak spot in the body. So we explained the patient about this phlegm fire model, that we don't just need to modulate the immune system, we also need to detoxify the phlegm in the body. That gives clarity to the patient that both are equally important. I cannot just, although at the surface it seems like it's lupus and we need to calm down the immune system, but they both are equally important. So keeping that in mind, we added the B vitamins, the Ds, the minerals, the probiotics, elimination diet, all the typical things that we do in functional medicine. But along with that, because from an integrative perspective, we are not rejecting of the allopathic medicines. One of the key medicines that does that job is metformin. It's one thing which does multiple things, clearing us of the environmental pollutants. And if used carefully and just in the right dose, it can simplify the plan for a patient. Because sometimes when the patient is doing so many different things, then it seems like it can be overwhelming for the patient. So metformin, at times in certain contexts, can be simplifying of the treatment. It activates the AMPK pathway and triggers the fasting mechanism. So the body goes into a natural detox mode, and it's been shown to clear a lot of different toxins. Of course, there are both upsides and downsides to any medication, and eventually the aspiration is the patient comes off all of them. And of course, we advise local applications, and we started a few homeopathic remedies which would match her constitution. That is how one looks at in homeopathy. There are local remedies and there are constitutional remedies. Constitutional are ones which match the overall symptom type of the patient. It's not just about the alopecia, but what's the emotions she's prone to, what kind of body she has, what kind of digestion she has. So we started her on constitutional remedies. The third visit was about Body Talk. Body Talk is an energy medicine intuitive system where the person lies down and we go into a state of a zone and we hold the hand of the patient and we intuitively go through a protocol, and stories related to that patient's life emerge. And my experience of doing that over the past 7 years is that I would have seen a patient for 1 full year. And we all, as FM practitioners, take pride in spending time with our patients, and close to 45 minutes to 1 hour. And I'm sure each one of us does that. But when I would do a body talk session for a patient, I would see a completely different person. And that would surprise me completely, that because where the real issues lie, nobody wants to talk about it. Nobody wants to talk about it, including me or you. All that is shoved underneath as a shadow. And I saw a person, she was a jewelry, she used to run a jewelry business, and how she carried a special consciousness within her. Special consciousness referring to, I am bigger than others. I am somebody more important. I need more attention than others. And in process, she was making the stakes very high for herself. At times when she was able to pull it off, she used to feel high. When she was not able to pull it off, she used to experience guilt and shame. And these were too high stakes for her to live with. So her first session was about that. Her issues with her in-laws emerged living in the same house. That's a pretty common pattern. Issues with daughters. And we did a series of sessions, and then I handed over the case to a specialized healer in the clinic. She worked with sound therapy, Bach flower, a lot of different remedies. And all this she was open to because she herself was a Buddhism Namyo Renge-kyo practitioner. And so she had that understanding that whatever I'm going through, it has a deeper cause. And I want to work on it because there are a lot of patients who would absolutely not want to go that way. Subsequent visits, there was ozone therapy, there was homeopathy, acupuncture, and very recently we did, she's been symptom free for past 3 years, but just for a general detox, she went through panchakarma as well. And within 2 months, she started improving. And since she visited, there were no new patches. She had pigmentations that improved. There was a period where her hair fall got exacerbated, and that puts us in a state of doubt. Do we need to increase the medication? A biopsy was done, and that showed no inflammation, which reassured us that we are on the right path. She lost weight, her gut health improved, mental health and relationships improved. Hydroxychloroquine was tapered by 2022, and 2023 it was stopped. And now it's been 2.5 years, touch wood. I always like to keep my fingers crossed. She's been off all medications. Another case is of a 25-year-old PhD student, PhD, IIT, aggressive work, a lot of stress, and he was getting these scarring patches all over his body and scalp. And 25-year-old boy to lose all his hair pre-marriage, it was a lot of stress for him. And again, similar patterns, insulin resistance, vitamin D deficiencies. And unlike Neha, who was going through, who had yeast sensitivity, he had a gliadin IgG antibody positive, which was gluten sensitivity. Thyroid was positive, heavy metals positive. And we adopted a similar approach with a lot of other things, which we usually do in FM, and that helped resolve the lesions. Now, I'm just going to talk a bit in brief about the common things in lupus. One is the gut microbiome, and there are certain bacteria, Rhinococcus, which are very much associated with the molecular mimicry, the DNA patterns, the decreased firmicutes bacteroides ratio, intestinal barrier, the leaky gut needs no mention, vitamin D receptor resistance. In autoimmune, unless proven otherwise, there is vitamin D receptor resistance, omega-6-3 imbalance, oxidative stress, glutathione depletion, EBV, estrogen, heavy metals, MTHFR, mast cell, and aryl hydrocarbon receptor dysregulation, especially from environmental pollutants. Now, some of the key things I've picked up to discuss is one is the role of estrogen in lupus, and especially in lupus, but in general, women are more prone to autoimmune. So I pulled out these studies, and they found that usually T regulatory cells, which are immune modulators within the body, CD4, C25 positive, are responsive to estrogen, estradiol. So the higher the level of estradiol, the better the Tregs. But that is not the case in lupus. They are less responsive to estradiol, and in fact, they're more responsive to androgens. And that's why DHEAS has time and time again shown to be a useful supplement in functional medicine in lupus. Then another thing which has been shown is urinary estrogen metabolites are higher in rheumatoid arthritis and SLE, and they are more of the inflammatory proliferative types, the 2-methoxy group rather than the 4 ones. So that is another thing which has been proven clinically in lupus patients. There is more aromatase activity in the inflamed tissue in the body, and hence more conversion to estrogens. HRT, the conventional one, has been shown to increase SLE. So there is no doubt about it. And estrogen OCPs are contraindicated in SLE. And only progesterone based or whatever is available in the market, they are only preferred. So even in the conventional medicine, this is clearly understood. And of course, what do we do in functional medicine to draw from that is, of course, work on the estrogen detox pathways, the CYP1A1, which takes it towards the 2-hydroxy, which is the helpful ones. So the broccoli sprouts or the dim and the rosemary and the green tea extract. And we understand here that DIM, there are a lot of studies which are going on. We all have been using DIM, but even in conventional medicine, there are studies going on for use of it in lupus. And then, of course, reduction of the CYP1B1, which takes it along the 4-hydroxy pathway, which is beautifully done by curcumin, resveratrol, quercetin. And these are things which are available in natural forms as well through grapes, berries, apples, onions. Then it's about the methylation, again, must have been talked about in detail. So we take care of the methylation, support desulfation, glucuronidation, use the candy-glutarate, the probiotics, the prebiotics, which are very helpful, whether it is isabgol or chia seeds, flax seeds, partially hydrolyzed guar gum. All these things are very helpful. And then, of course, we avoid the xenoestrogens, which are the BPAs and the plastics. And this way, we can take care of one of the key elements in lupus, which is estrogen issue. In this case, all the detox, whether it is the diet or the metformin and the supplements, they were doing that job for us. And then, of course, in more difficult cases where this is not enough, progesterone can be added and all the other things. Then another key phenomena in lupus is NETosis, which is nuclear extracellular traps. It is the DNA fragments of the neutrophil which are sent out and which are meant to phagocytose all the toxic stuff. But it is because of the excess antibodies present and there is a lot of neutrophil degranulation happening. And then these chromatin structures are lying in the blood naked, to which, because in SLE, it is the anti-nuclear antibodies. So the immune system is attacking the DNA. So it starts to attack these fragments, which in turn releases more IFN alpha, interferon alpha, and gamma, which in turn worsens lupus. And then there is more neutrophil degranulation. So this is a vicious cycle in lupus, which is a very interesting phenomena because this is what goes out of hand in lupus. And so this is described in the slide that first the trigger event and autoantibodies, then NETosis, then plasma dendritic cells pick up these chromatin, and then there is amplification by interferon alpha, and then furthermore NETosis, and that leads to organ damage. Now, again, curiously, one of the most beautiful things which helps in allopathy with this NETosis is hydroxychloroquine, which has an action on the lysosomes in the neutrophils. So, albeit an allopathic medicine, but it offers a relatively safe way to deal with this NETosis situation. I won't go into the other allopathic medicines too much. In the functional medicine, NAC, N-acetylcysteine, is a beautiful way to deal with the NETosis. And then, of course, the curcumins and the resveratrols and the vitamin Ds. The other third thing about lupus is the role of EBV, Epstein-Barr virus, which has shown a lot of interest. And what has been shown, what are the evidence in favor that EBV plays a role is in regular adults, 90 to 95% are affected by EBV. But in SLE patients, it's 99.6%. So it's almost anybody who has SLE has had an EBV infection. A lot of patients have been shown to have 10 to 40-fold higher EBV load, which leads to and there have been showing more frequent reactivation of EBV in lupus patients. And then, of course, we know it triggers the same IFN alpha pathway and the whole gamut of cytokines in EBV. EBV is a conundrum and a challenge for each and every one of us, whether it's an allopathic, functional medicine, any form of practitioner. These are some of the things which help: the EGCGs, resveratrol, Kalmeg, common Ayurvedic herb, androgapholide or Andrographis paniculata, licorice or mulethi. These are two common herbs which are very useful in the same, the quercetin and the olive leaf extract, the ozons, the HBOTs, hyperbaric oxygen. All these things are also very helpful. And energy medicine is very helpful in dealing with EBV because we attract certain viruses towards ourselves because of certain emotional patterns also. So it is very helpful. From an allopathic perspective, antivirals have some role. Valacyclovir less. Tenofovir, which is an HIV drug, has been shown to be more effective. Hydroxychloroquine again comes in because it's a broad spectrum antiviral. We don't need any guesses. It was used so much for COVID times as well. And then, of course, there are more future ways which are emerging from vaccines to first teaching the T lymphocytes how to deal with EBV and then re-injecting them. So these are some future options. And I come to the last part of the presentation, which is close to my heart, which is the art of integration, because I live and practice every day with the aspiration that how we can bring the Eastern and Western medicine together. Because integration is not about picking up protocols from some doctor in another part of the country or from the West and copying it in our practice, but it is about seeing in the given situation, in the context of that patient, what is available. For a poor person who earns 10,000 a month, the context may be different. For a person who earns 1 crore a month, the context may be different. So it's about what is available to us in that situation. We need to be flexible and create a model. So art of integration is first integration of what is available in that context to the patient. The second is integration cannot happen from a surface level consciousness where we are identified with our ego, because ego tends to favor one polarity over the other. When the mind is more active, then the logic becomes more active. When the heart or the prana is more active, then we are more drawn towards choosing what is easy or what is more soothing or what is more attractive to us. It is only when we go into the depth of the consciousness, when we withdraw from our surface consciousness and we embrace our infinite possibility, can our vision widen enough to see both the polarities and bring them together. Whether it is the attractive functional medicine from the West, which offers quicker, measurable, simplified, well structured solutions, or it is the Eastern medicine, which challenges our thought process, which is subjective, which may not be so easy to understand, and which may not have so much data support. The patient may question it, but it offers a deeper healing. It's only when we look at it from a depth of consciousness can we adopt the integrative approach. The second is to empower and educate the patient and let the patient choose. We are not the doers. The patient has to choose what he wants to do. Third, always focusing on the foundational elements. It's the iceberg model which comes in handy for all of us. Tip is the symptom, underneath is the biochemical dysfunction, underneath is the life choices. The more we focus on the foundational elements, what is the person eating, what is the person drinking, what is the doing, what is the emotional choice every moment, the lesser we need the top stuff. Another thing which I've not mentioned here is when it comes to Eastern medicine, we all want to learn about herbs. We all want to learn about natural methods of healing, but they slip out of our hand. And it's happened personally to me. I have really wanted to pursue Ayurveda, but slipped out of our hands because Eastern medicine cannot be understood through ambition. Eastern medicine, to learn it, you need to let go of the ambition. You need to let go of the personal gains and you need to bow to it. Then Eastern medicine opens up to you. And the one power which can help us transcend ambition, which is a very strong power which takes us over all of us, is faith. Faith burns all ambition, faith in something greater. And lastly, it's about facilitating the healing, which goes much beyond medications and supplements. And we're doing this in our clinic. Sampurnam Holistic, Dr. Kohli spoke in the morning, Dr. Pankaj, me, Ayurveda doctors, foundational practitioners, healers. We are trying our level best to bring this ethos together. And we are trying to bring it in a range of supplements as well, where we have, for example, this for PCOD, there is Endobalance, which is a herbal combination to the functional medicine stuff, everything being put together at one place in Veritem Health. Verity stands for truth, M stands for empathy, veritemhealth.com. Thank you so much. I hope you enjoyed the session and looking forward to questions.
Um, I am really short of words to say anything over here. I'm just gonna stop the screen there, share there. Dr. Mankul, I definitely have to tell you one thing. Your calm aura definitely showed how wonderful it is for a patient to feel that the doctor really cares about me. Um, that really makes such a huge difference The case definitely was something again anybody would be scared to even deal with, but the depth with which you have integrated every little thing that you have learned is so beautiful. And I think everyone, the hearts have come for you, not for me. The hearts are there to tell you that how much this, so much this is human. This is being human. You have to give the best solution that you can, and you are definitely doing an incredible job. I would say the entire team. And through in an online conference, usually you can't do a loud round of applause. You can do a loud number of hearts. That's why everyone's giving that. So let's go to the question and answer panel. I'm just gonna go. Um. Okay. Okay. I have only seen, are there homely remedies? Please help. And just a minute, let me go to this question by Rituparna. So she says, "Good afternoon, sir. One of my most nearest one is in a remission state of SLE with the grade 4 nephritis. She was having MMF. Now it has been discontinued. She's now having HCQ 300. If you could let me know, how can we stop the flare-ups to come in future?" This is her first question. Should I continue with the remaining? She says we have both vegetarian and non-veg foods, particularly green and colored fruits and vegetables, also chia seeds, flax seeds, etc. But to be honest, deep inside, we are always in a state of tension. How can we come out of that? And how can we empower the said person?
I think the key point in any kind of treatment is feeling a sense of fulfillment. Sometimes we are feeling that we are doing a treatment, we are going to the doctors, but there's something which is missing. When we are addressing the foundational elements fully, that sense of fulfillment comes. So, what I see, there is a part of you which feels something is missing. And what we talked about in the talk, all these elements can be filled up through the found diet, lifestyle, exercise, everything. There must be an emotional bit, but there's a lot that can be done beyond hydroxychloroquine, as we shared during the presentation in terms of all the pathogenetic factors, and we need to go through that. So the talk it would be limited to answer it in a one sentence thing, but I sense that lack of fulfillment, and seeing any of the doctors in this forum would do justice to it.
So out of the blue, I have a question that I want to ask, that the caretakers, the caregivers, rather, I would say, are the people usually see, I mean, you don't like to see your loved ones suffer. What do you do for them?
See, the paradigm needs to shift. The paradigm is usually that we are operating out of is that this disease is a problem in my life. I need to remove it. That is a survivor's mindset. Survivor's mindset is either trying to fight the disease or trying to think that there is no disease.
You need to name
I'm
it
okay.
and tame it. That's it.
That's way. The thriver's mindset is that this has come here to change the course of my life, whether it is me or if the caregivers, it is here to teach us something, and it is here to change the course of my life, the whole community's life, and there is some learning in it for me. And the starting point is gratitude, that thank you, bring it on, this is, we have chosen it. As a soul, we have chosen to go through this difficult journey much before we have been born. So the idea is we become grateful for it and we become peaceful enough for the learning to emerge. When the learning emerges, the fulfillment comes and we move forward. When the family adopts the thriver's mindset, then the support and everything comes naturally.